So everyone is on mute except for Candace and myself right now. And I am so pleased, and I really thank you so much, Candace, for joining us. You really do such a lovely job of presenting, because you make it simple, for those of us who don't know it as well as you do. And I know that you're going to talk about in-home care and long-term care for advanced Alzheimer's and dementia. So please introduce yourself and go take it away.
Thank you, Evelyn. Hi, Cindy. I'm so glad to be here today talking about a topic that's really near and dear to my heart. As I mentioned earlier this year, I lost my grandma and she suffered from dementia. And I actually got to be a caregiver for her during her time. And so I have kind of used this as my opportunity to really share on some topics that I feel can be very confusing. There's a lot of myths around it, and then also can feel very overwhelming. So I really hope that today, in the information I'm giving you, please know that I'm not giving you the information to scare you, because when I talk about money and cost, it can definitely be very scary, of course, in the current conditions that we're in with inflation, things like that. But it really is to prepare you and for you to get a better understanding. So that way, when you're going in or you're looking for in-home care or residential care, nursing homes, assisted livings, that when they tell you how much it costs, that you're prepared for that, and you're not in that shock factor of thinking, how am I going to pay for this? What am I going to do? This will hopefully give you the basics of understanding who can pay for it, who's a part of it, and also some questions to ask. So again, none of this is to scare you. It's to help prepare you to answer any questions that you may have, and know that there's resources and support out there for you to help you along the way. So I'm going to go ahead and share my screen now. Everything good, Evelyn?
Looks good.
Okay, perfect. So I'm Candace Ramos. I'm the Senior Director of Market Development at VITAS Healthcare in San Antonio, Texas. And in about a week from now, I will have been at VITAS for 7 years. So I'm super excited to hit that lucky number 7. The objective of today's call is to ensure that you guys understand the types of in-home services, types of residential care setting, choosing a care setting, and questions to ask, as well as potential costs for either of these additional services that you may need for your loved one. So in-home services, not all in-home services are the same. Some in-home services provide non-medical help, such as assistance with activities of daily living, which would be bathing, dressing, toileting, just to name a few. Other in-home services involve medical care given by a licensed health professional, such as a nurse or a physical therapist. So some common types of in-home care are companion services, which help with supervision, recreational activities, or visiting. So they're just coming by to be a companion, visiting, having conversations, checking to make sure that they're doing okay, really acting like that family member that maybe doesn't have the opportunity to come by because you're working during the day, but just doing drop-in visits. Personal care services, they do assistance with activities of daily living. So they are able to help with bathing, dressing, toileting, eating, exercising, or other personal care. Homemaker services, which help with housekeeping, shopping, or meal preparation. And then there's skilled care, which is usually known as home health. So that's care provided by a licensed health professional. So they usually help with wound care, injections, physical therapy, and other medical needs by a licensed health professional. Oftentimes, a home health agency coordinates these types of skilled care services once they've been ordered by a physician. So in order to be on home health, that's something that would have to be ordered by a physician in order to receive those services. So when you're interviewing, move this out of the way. Interviewing in-home services, there's some questions to ask potential in-home service providers. Prior to interviewing them, you want to call them and ask some questions to ensure that this is the type of care that you're looking for. So you'd want to talk to them about what kind of services that you're looking for, kind of some of your basic expectations. It's perfectly fine to call more than one company because different companies might have different levels of service. So just to give you some examples, some in-home care provider services have a minimum number of hours per week that have to be provided. So they'll say the minimum hours per week for my agency is 20, where some agencies might say we have no minimum, or some they have sliding scales. So just depending upon what exactly you want to know, how many hours you're looking for the care to be provided. So that way up front, they can let you know whether or not they're able to work with what your expectations are. And I know a lot of the times we go in unprepared or not really knowing what it is that we're needing and asking for a recommendation. So you might start somewhere and say, okay, 20 hours a week. That breaks down to what, about 4 hours a day. So if you were to have someone to come 4 hours a day, would you want them to come at 8 a.m. till 11 a.m., 12 p.m.? Would you want them to come in the afternoon until someone gets home from work? Would you want someone to come for 10 hours a day, 2 days a week? When you look at 20 hours, that's kind of how it would be split up. So some of the questions, you would also want them to come into your home where they or their staff would be providing the care, so that you get a good idea of course, your loved one is there in the home with you. So they get to meet your loved one there at that time when they're doing the interview. And it paints a bigger picture of the kind of care that's actually needed. And so that's how they'd be able to make some additional recommendations if additional care was needed, or for them to actually see what kind of care would be provided. So some questions to ask would be, do you have experience working with someone with dementia? Are you trained in dementia care, or is your staff trained specifically in dementia care? Are you with an agency, if that's important to you? So there's options in a case where you could actually hire your own caregiver, and you would be, let's say, the manager of that caregiver, and you would be responsible for the taxes and the payment to that specific caregiver. Or you can work through a provider service agency that already has staff, and they would be responsible for providing the staff and covering the insurance, and they would have a rate that they would pay that specific employee. Are you available at the times needed? So based off of the times that you are needing care, do they currently already have someone available at the times you're needing, or are they going to have to find someone to meet the needs of your times? Again, because it's not around the schedule of what the provider service company can do, it's about what you need. So when your hours are needed, when you need someone to be there, can they support you at that time? Not when, oh yes, I have staff at this time, can we do this instead? If it works with you, fine. But again, they're supposed to mold the care around what your need is. Is there a minimum number of hours per week? Are you able to provide backup if the person is sick or there's a call out? This is very, very important, because at the end of the day, if you're expecting and you're paying for someone to come a specific amount of hours or a specific time per week or specific days, because let's say that you have to be at work, or whoever needs to be relieved and take, that's why you're hiring them, is because there's a specific need. In the event, because we're working with people that for some reason that CNA or that aide is not available, what is the backup plan? So the majority of time, the backup plan is on you as the family, because that is your loved one that is needing the care. Same as if your child is sick and they're not able to go to daycare because they don't allow sick kids in daycare. You would have to, a normal person would have to stay home from work or find additional care for that person as backup to stay home with that child. It's the same scenario like this for in-home care. It's possible that they might have someone that is a backup, but there's pros and cons to that, right? If they've never worked with your loved one before and your loved one has dementia and there's a new person coming in, that could be very challenging for your loved one, and it might not end up the same way or be providing the same care that you're used to, or it might not work for you and your loved one because that's not the norm. That's not what they're used to. So it's a good question to ask, but also good for you to be prepared of, if I am hiring a private caregiver in that for some reason they are not available, I still am responsible for having that backup plan of who's going to provide care to my loved one at that time. Are you able to manage our specific health and behavioral care needs? So is someone from your agency able to manage the care that my loved one needs? So they're there in your home seeing what's going on with your loved one, to be able to say, yes, I have someone that's trained in that care. I have someone that has 20 years experience in working with dementia or Alzheimer's patients, or this is a new person that has just started and doesn't have experience. So that's why it's important to ask those questions. So who pays for in-home care? The most common form of payment for in-home care is private pay out-of-pocket expense. So in-home care would be paid usually at an hourly rate, depending on how many hours of care is needed. And that I'll go into it the cost a little bit more, but it'll be contingent on the type of care provided, the type of person that's providing the care. So if it's a nurse, if you want to have a private nurse, that's going to be more expensive than having a CNA. And a CNA is going to be more expensive than having a homemaker, because it depends on what that in-home care service is actually providing and doing. So once we get into more clinical complex care, medication management, things like that, the cost starts to go up. Long-term care insurance, and I'll go into that one a little bit deeper. The VA, aid and attendance. So there must be a service connection. So it's good if you currently, or if your loved one is not already service connected to the VA, that you start working on that ASAP, because in the event that you wait to apply for aid and attendance and you are not service connected, there can be up to a 6-month wait to get approved for aid and attendance. So the first step is apply to be and make sure that you're service connected to the VA. So that way, once you are needing the service, even if you don't need any services right now, then you will already be in the system and will able to move more quickly through the system. Medicaid, depending upon where you live or what state you're in, it could take up to 45 days to receive authorization for Medicaid to provide provider services. And you must have a referral to their program, to the Medicaid provider program, usually by a social worker or by a physician or someone that is able to put in that need. So even like a case manager or social worker in a hospital or in a nursing home would be able to provide that referral. Now, something newer that's been popping up, which Medicare Advantage plans are not newer, right? But some Medicare Advantage plans are offering provider services based on the specific plan. So that's one thing that if you're looking around or you're shopping for a new Medicare Advantage plan, or you're thinking about Medicare Advantage plans, that's one additional service that some Medicare Advantage plans might offer, whereas traditional Medicare does not pay for any in-home care services, private in-home care services. So the cost of in-home care. So your needs are unique. So let's look at some of the things that could impact the cost of companion care. So a typical homemaker companion service costs about $163 per day. Home health aides or a CNA costs about $169 per day, and for a 10-hour workday. A registered nurse would make $398 per day. In most cases, these types of services are not needed all day or even every day, which is what I discussed earlier, like how many hours are you going to be needing this service? If you need 24 hours a day, then these organizations do offer 24-hour-a-day care, and you are able to pay for that. But of course, that cost will go up based on the number of hours of care needed. So Part-time versus full-time. The amount of companion care hours per day affects your cost. The price for 24/7 living care is higher than employing a sitter for a few hours each day to help with activities of daily living. Specialized care. Companion care can be straightforward as having company during the day and keeping your mind active through brain games and conversations, such as specialized care, such as memory care for dementia or Alzheimer's disease, involves a distinct home care skill set at an increased cost. And then there's at home versus a facility. So that can also be a cost differential. And then again, a homemaker versus a nurse. So pay rates for homemakers are a lot lower than nurses, since homemakers do not require a license or a certification. If your needs go beyond basic companion care, a licensed nurse is preferable. Again, these costs are not to scare you, just prepare you. When living at home is no longer an option, there may come a time when the person living with Alzheimer's disease or dementia will need more care than can be provided at home. During the middle stages of Alzheimer's, it becomes necessary to provide 24-hour supervision to keep the person with dementia safe. As the disease progresses into the late stages, around-the-clock care requirements become more intensive. So as your loved one starts to decline or have further disease progression, it's okay to say that you need additional help, or it's okay to say, you know, for my sake and for the safety of my loved one, it is best for them to go to a place that can provide the care that they need. It doesn't mean that you're giving up. It doesn't mean that you don't love them. It doesn't have any emotion to the fact that you are just doing what's best for them. And it's okay to have that overwhelming feeling, and we get to that point. But know that there are options and there are things that can be done where, even though you're not the one providing the 24-hour care, because who can go on and on for months or even years being a sole caregiver to someone, it's okay to look at placement as an option. And I want to prepare you as we go on in this, as you know, with questions to ask, what to look for, and you be comfortable and confident in the place that you're choosing for your loved one. So long-term care. We're going to learn about the different types of long-term care to determine which one best fits the need of the person living with dementia. If the person with Alzheimer's or dementia prefers a communal living environment or needs more care than can be provided at home, a residential setting may be the best option. Different types of communities provide different levels of care depending on the person's need. Making the decision to move into a residential care facility may be very difficult, but it's not always possible to continue providing the level of care needed at home. The questions below may be helpful when determining if a move to residential care is a good option. So ask yourself when you're wondering, is it time for residential care? Is the person with dementia becoming unsafe in their current home? Is the health of the person with dementia or my health as a caregiver at risk? Are the person's care needs beyond my physical abilities? Am I becoming a stressed, irritable, and impatient caregiver? Am I neglecting work responsibilities for my family and myself? And would the structure and social interaction in this setting benefit the person with dementia? So here are a couple types of residential care places. So there's retirement housing, which may be appropriate for individuals in early stages of Alzheimer's, sometimes referred to as the middle age in a medical context, who are still able to care for themselves independently This type of senior housing generally provides limited supervision and may offer opportunities for social activities, transportation, and other amenities. So these are your apartment type living 55 plus communities, where it's a community of those that are age 55 and up living in an apartment complex, or sometimes a resort, because now there's houses and all different types of living spaces in these type of communities based on what kind of place you want to live in. And then also they have a pool and they have events and they have get-togethers, and it really is a great place for those 55 and up to live and be a community together of people around the same age with the same type of amenities for those that are 55 and up. Assisted living. So assisted living bridges the gap between living independently and living in a nursing home. It typically offers a combination of housing, meals, supportive services, and healthcare. Assisted living is not regulated by the federal government, and its definitions vary from state to state. So based on the state that you live in, there might be specific licensing and requirements for your state. So not all assisted living providers offer services specifically designed for people with dementia. So there are certain assisted livings that can tailor to care for dementia patients, and there's some that do not at all. So that's something that you want to think about when you're looking for assisted living specifically for your loved one with dementia. There are two primary types of assisted living communities in Texas, which is where I am. So I'm sorry, but I'm going to talk about Texas because that's what I'm most familiar with. But I am going to share some things about some other big states in the USA. So in Texas, there's type A and type B facilities. Both types of communities must be licensed by the Texas Department of Aging and Disability Service to operate legally in the state. The assisted living type A or type B license are determined based on the resident's ability to evacuate the facility during emergency and whether or not they require nighttime supervision. Type A facilities provide basic support services to elderly or disabled individuals. They may include personal care assistance such as grooming, dressing, bathing, and toileting. And they also assist with activities of daily living like shopping for groceries, preparing meals, managing medications. Type A assisted living does not require nighttime staff attendance, and residents can usually evacuate the facility on their own in a time of an emergency. So I kind of think of this like hotel-like living, where everyone has their own apartment or room inside of a building, and the amenities may differ depending on the type of facility, where they may be able to have a microwave or may be able to have a mini fridge. They'll have a bed set up in their room. They'll have their own private bathroom. But there's not actually anyone, there's some assistance with ADLs, but there's not necessarily someone there providing clinical care 24 hours a day. And the people that live in these types of facilities are able to evacuate on their own. So like they'd be able to get up out of bed and go down, which if there's a fire, you wouldn't want to go down the elevator, but go down the elevator by themselves as needed, or walk down the stairs carefully if needed with basically no assistance. But type B assisted living facilities offer a higher level of care than type A facilities. They provide 24-hour medical care and additional medical services, such as wound care and medication administration. These facilities also have a higher staff to resident ratio and require regular nighttime staff attendance. In addition, in the type B assisted living, residents may not be mentally or physically capable of evacuating the facility on their own during an emergency. So there will be more staff in a type B facility, and they would be providing more medical care based on the need of those patients. So again, for Alzheimer's and dementia patients, a type B facility would probably be the best option for them, based on there being 24-hour staff, but of course there might be in type B facilities, you can still see residents with dementia walking around. So it doesn't mean that you have to be bound to a wheelchair. They still are able to walk. Some are still able to communicate. It might just be that maybe they don't know where the exit is, or based on their dementia, there are some things that, whereas if they needed to evacuate, they wouldn't necessarily know what a fire alarm going off means. So that they would need that additional support. So it'd have more of like a locked doors, and everyone has their own private room where most of the doors are open, and there may be some wings where there are more patients that are wheelchair bound versus some where they're more active and they're able to get together to play bingo or play games in their hall. But I kind of look at that as like, I guess you could compare it to like dorm room living. So everyone has their own room, but yes, they'll have their own bathroom, but there's those communal areas where they can gather together out in the center, and they eat together out in their dining rooms. So there's also personal care homes and residential care homes. So a personal care home is a private residence, most often within a subdivision, that offer personal care services, assistance, and supervision to 4 or more persons. They offer a smaller, more intimate setting, ideal for persons who might not do well with large assisted living facilities. Personal care homes, also known as adult family homes, boards and care homes, or residential care homes, offer personalized service to a small group of adults. These residential care homes provide lodging, meal services, and assistance with daily living. So if you've never been to a personal care home, or you've never heard of a personal care home, it could actually be a home that is next door to yours, where there is someone that allows for those needing in-home care services to live in their home, and they either hire staff or they live there and provide the care to those individuals that they are taking care of in the home. So basically, you would be paying for room and board and care for your loved one. And when we're thinking about a home, majority of the time they will have anywhere, I've seen 2, 3, 4 residents in these personal care homes. So it's more, think about, it's 2 bedrooms, maybe two patients per room, or sometimes they offer private rooms. But of course, that would affect the cost of the care as well as the clinical needs of the loved one living in those homes. They might have cameras in the home, so that way you're able to access the camera. There's someone that's able to get to them 24/7 in the event that something happened at night. They make home cooked meals in the home based off of the needs of your loved one. They'll ask you questions about what type of hobbies or things do your loved ones like. And so they'll try to keep your loved ones engaged in that. They'll do outings. It really just depends on the personal care home. But it's, instead of living in a large place like an assisted living, or you're able to live in a smaller home, that's that home-like setting, and someone providing that more one-on-one care, where when you think of a facility, sometimes it's 1 CNA to 10 patients. So it really just depends on if you're wanting that more one-on-one specialized care, or if you're okay with them being somewhere that may have more offerings based on their needs. It really just depends on what your preference is, or what your loved one's preference is. So then there's nursing homes. So these are also called skilled nursing facilities, long-term care facilities, or custodial care. And nursing homes provide around-the-clock care and long-term medical treatment. Most nursing homes have service and staff to address issues such as nutrition, care planning, recreation, spirituality, and medical care. Nursing homes have different staff to resident ratios, and their staff members may have various levels of experience and training. Nursing homes are licensed by the state and regulated by the federal government. Then last but not least, there are memory care units. So memory care units are designed to meet the specific needs of individuals with Alzheimer's and other dementias. Memory care units can take many forms and exist within various types of residential care communities. So these could be in assisted livings, and they may or may not be locked or secured units. Such units most often are cluster settings in which persons living with dementia are grouped on a floor or a unit within larger residential care buildings. Some states have legislation requiring nursing homes and assisted living residences to disclose their fees and list the specialized services that their programs provide, including a trained staff, specialized activities, and ability of staff to care for residents with behavioral needs. Because laws varies, it's important to ask specific questions about what type of care is provided in a secured unit to ensure that the level of care is appropriate for the person. So I've seen there are secured units in nursing homes, but again, not every nursing home is going to have a secured unit. There's secured units in assisted livings, mainly in type B, but again, it doesn't mean that every assisted living is going to be a type B. It doesn't mean that every assisted living is going to have a specific unit for dementia patients. But usually the doors will be locked so that no one is able to get out of the door. So there's sometimes a code that has to be entered to gain access to the doors. There may also be your loved one wearing some kind of bracelet or ankle bracelet. No, it's not that they're locked in a prison, but really it's so that in the event that they were to wander off, that they would be able to locate where your loved one is, or that the doors would shut so that they wouldn't be able to pass through open doors. Really, it's just to ensure safety at all times. That's the point of these secured units, which behavioral circumstances, there are some patients that are more aggressive. And so really them being in these locked units is to keep them safe and to keep other residents living in the same building safe. So that's something that you're interested in, or there might be a time when your loved one, you have to transition from place to place. So your loved one may be living in assisted living and may be doing fine in assisted living. And then as their disease progresses, they may need to move. And so depending upon what type of clinical complications may be arising, because the behavioral part is clinical. So there is clinical care that can be provided for behaviors or that aggression or whatever might be going on. You may be recommended to go to transition to a nursing home at that time. So there are times, depending upon the care that is needed, that everyone wants to ensure that the care is best for that specific patient or your specific loved one based on their need. So don't kill me on this part. There are a ton of questions to ask, a lot of questions, and you want to be prepared before going in of the questions that you're going to ask. And I think that it would be good if you're going in and touring. So a lot of the times you do a tour of these facilities. And so they will have a representative that will take you on a tour, talk to you about the services needed, and offer you the price ranges. But when you are doing these tours or when you're talking to them and you go to multiple facilities, these are some of the questions that you may want to think about asking. So family involvement. Are families encouraged to participate in care planning? So nursing homes are required to have care planning meetings for all of their residents. Assisted livings are not required to have care planning meetings, but at any time, either the staff of the assisted living or like I work in hospice, sometimes the hospice will ask for a care plan meeting and the family should ask for a care plan meeting, but all those entities would come together in one meeting, but it's not something that's routine. It's usually for some reason, maybe there's a decline in care or something's going on with care. And so that's why we would have a care plan meeting in an assisted living, whereas in a nursing home, that's something that's regular and required by the nursing homes to have those care plan meetings. How are families informed of changes in residents' condition and care? So in the event that there's a change, would you be calling me? Is there someone available to call me 24/7? When do you want to be called? Do you not want to be called at night? Do you only want to be called during the day? Are families encouraged to communicate with the staff? I'd be hopeful that because you're the loved one, you're the advocate for your loved one, you're the one to speak for your loved one, and they should be open to whatever questions or care or direction that you might be providing. Because again, you are paying them to provide this care and support. Staffing, is medical care provided? How often are physicians and nurses or nurse practitioners on the premises? Is there a registered nurse on the site at all times? I know for most assisted livings, they are not required to have a registered nurse on site. They will have a nurse, but it's not required for them to be a registered nurse. It's not required for them to be there 24/7. So they usually have a nurse on call overnight. A nursing home also has a registered nurse on call 24 hours a day, but it doesn't necessarily mean that there will be a registered nurse on site 24 hours a day, but there will be LVNs. Is personal care and assistance provided? So in what I'm paying and what you're saying is included in care here at this facility, is personal care and assistance provided, or is this somewhere where I would have to sometimes hire outside private caregiver to come and provide additional care in an assisted living or wherever it is that my loved one is living? Or is it, and we'll talk a little bit about the a la carte of assisted livings in a little bit, where if you're going to provide a specific amount of personal care, that's going to be an added cost per month for that care. Is care personalized to meet the specific needs and abilities of and interest of my loved one? So again, I work in hospice and not every patient is the same. So just because someone has Alzheimer's dementia does not mean that every Alzheimer's and dementia patient is exactly the same. So the care should be around the need of my specific loved one and not, oh, because they have dementia, they're in this specific glass box and everyone with dementia receives this same care. Is the staff trained in dementia care? Is it required by the state? How long is the training and what topics do you provide training in for your staff? On average, how long have workers been on staff? So one thing that I always, and I've learned this in my experience in healthcare, is I do not recommend rating a facility based on how new it is or how fancy the facility looks. So chandeliers and beautiful furniture and painted walls, newer painted walls because it's a brand new building, and landscaping outside and so on and so forth. Because you can always decorate a room to make it feel like home, but you can never change the staff and how they provide the care. You as a loved one have no control over the staff. You have no control over the training of the staff. You have no control over if the staff listens to you or if the staff shows up to work or whatever the case may be. But what you do have control over is making sure that your loved one, by asking the question of how long has the staff worked here, that usually can tell you if the staff is taken care of, if they enjoy coming to work, if they enjoy working at the facility. And you have control over decorating the room to make it feel like home. So the same things that your loved one has at home right now in their room, pictures of your loved ones, paintings from their grandchildren, any specific mementos that they might have in a room that you can put in a box and take with you to the facility. Majority of the time you can take that with you. You can hang pictures on the wall, but you have no control over the staff. So if you take one tidbit from me today, I hope that that is the main one, because in the city I live in now, there are a lot of facilities that I would choose that I am confident in their staff's capabilities versus how their building looks or even sometimes smells. So I'm just gonna leave that one there. How does the staff handle challenging behaviors? So in the event that your loved one is experiencing behaviors, how is the staff handling it? Are they just calling you and having you run over to assist with your loved one? Because at the end of the day, again, remember, you're paying them to provide the care to your loved one and the appropriate care based on their need, not for you. Your loved one's in trouble and they need you to come and take care of them and handle them. That's not how this works. What is the ratio of residents to staff? Some questions about activities and resident care. Do planned activities take place? Ask to see an activity schedule. Note, if the activity listed at the time of your visit is occurring, so they might have a calendar with activities listed, but when you're there and there's a 10 o'clock activity for music therapy, is that actually happening right there when you're there? Like, do you actually see the activity going on? And do you see other residents participating in the activity? Or do you see those that are providing the activity actually interacting with the residents? Are activities available on the weekends or during evenings? Your loved one lives in a facility 7 days a week, 24/7, 365 days a year. They're experiencing Christmas, Thanksgiving, Easter, Mother's Day, Father's Day, all the holidays. And we would expect that they would be receiving that same in a facility. Again, most facilities are not Monday through Friday, 8 to 5. They are 7 days a week. But do they offer activities or do they do special things for the residents on those days that are not Monday through Friday? Is transportation available for medical appointments and shopping? Is there therapy provided in-house? Is there a dementia-specific care unit, which we talked about earlier? Are religious services and celebrations available to residents? When it comes to the resident care, is there flexibility in personal care times based on an individual's schedule? In my experience, not everyone likes to receive a bath at 6 a.m. I know that I don't majority of the time, but are you waking up my loved one from a deep sleep to take a bath, and how is my loved one reacting to that time? Or for you, does your loved one normally not wake up till 10 a.m. and then you don't give them a bath until after they eat their breakfast, or maybe they prefer afternoon bath? There should be flexibility to offering bath based on what works best for your loved one. Are residents comfortable, relaxed, and involved in activities? Are residents well-groomed and cleaned and dressed appropriately? Another one, what is the rate of falls? So here in Texas, all residents living in facilities have the right to fall. Everyone has the right to fall, so nothing can be done to constrain someone from falling living in a facility. You might not know this. What is the rate of falls? So the goal for these facilities is to try to prevent falls as much as possible by someone checking on the resident, ensuring that the resident is walking safely. If you see them walking around and they're supposed to be walking with their walker, that they're trying to ensure that your loved one is having all the necessary things needed to prevent a fall. Not all falls are preventable. Unfortunately, for dementia patients, falls do happen. It's not intentionally, it's an accident, but that's something that's appropriate to ask, because it also could be based off of the staffing model. So based on how staffed they are, then there may or may not be an increase in the rate of falls. Are there more falls at night than during the day or the weekend? So that's something that's very important to ask. But also, I just want you to be aware that not as much as we try and we hope and we don't want our loved one to fall, it's inevitable that is going to happen. And I'm not saying that we have to be okay with it, but do make sure that you are prepared yourself, that your loved one might fall and they might have skin tears and they might break a bone or have a sprain. And unfortunately, that's part of the disease progression. But the more additional care that they receive, I've had some situations where if they're living in if a loved one is living in assisted living, some families might hire a private caregiver to spend all night with that loved one to help prevent a fall. But again, that's additional out-of-pocket cost to prevent a fall. Is it worth it? In some cases, yes. Is it expensive? Definitely yes, but just something for you to think about. And then, are residents with psychiatric illnesses as their primary diagnosis on the same units as residents with dementia? And of course, that's just for safety, what you're comfortable with, what might trigger your loved one to not feel comfortable or might increase anxiety or agitation because of someone else that may be bothering them. The environment. So is the setting free of unpleasant odors? I hate to say that when we wore masks and had to wear masks, That was definitely helpful, but sometimes accidents happen. So how quickly, if there is an accident or something happened, that they are cleaning it up and trying to ensure that it's not noticeable for others, or if they're in a shared room, would you want to be in room with someone for hours and hours that maybe had an accident? So usually when you walk into a building, that's something that is highly noticeable. Is the setting easily to navigate? So usually there's one common area and then there's multiple halls throughout a building. So it'd be easy for your loved one to find their room. Some are usually in a circle, some are in a square, some are in a rectangle, just depending upon the facilities that you're visiting. Is there a designated family visiting area or private place to have visitors? Are residents allowed to bring familiar items like photos, bedding, a chair? One time at Poets Walk, I did help a husband carry a chair into the facility for his wife. So yes, I know in some places you can bring in your own furniture. Do the visiting hours work for the family? Is continuing care available as residents' needs change? So again, if you're living in a assisted living type A facility or even a type B facility and there's changing in the residents, like, would you be able to keep my loved one here? One example is if they continue to decline and they're needing hospice services, are you able to provide care for those that are on hospice services? Or, if my loved one's needing more 24-hour care, do they need to transition to a nursing home or a personal care home, just depending upon what that recommendation is? Is there an aging in place policy where residents can remain in the community, even the same room throughout the course of the disease? Does the community provide an escort to the emergency room if a visit is required due to an illness or an accident? So again, usually the facilities end up becoming your loved one's additional part of the family, and they're comfortable with those, the staff members in the facility. So if they were to have to go to the hospital, would they just let them go to the hospital by themselves? Like, sometimes I know we have loved ones that don't even live in the same state or city as us. So by the time we're able to get to the hospital, would my loved one be by themselves that whole time? So that's a good question to ask if it's appropriate. Does the community provide end of life care and hospice care if it's needed? I promise this is my last page of questions, and I hope you're writing down a couple that you feel beneficial. So questions about meals and nutrition. Are there regular meal and snack times? So specific times of day for meals and snacks. Is the food appetizing? Ask to see the weekly menu or come in for a meal so that you can taste it. Is dining environment pleasant and comfortable? Are family and friends able to join in mealtime? Is staff able to accommodate special dietary needs? So if there's a low sodium diet or diabetic, or if they need more softened foods, blended foods. Does staff provide appropriate assistance based on person's ability? So in the event that your loved one needed actual help and assistance with feeding, is there someone from the staff that would be able to sit there with my loved one to feed my loved one? Are there any environmental distractions during meal times? Is it too loud or noisy, usually with TV or music? Now, again, I gave a disclaimer at the beginning. Please do not fall out of your chair when I talk about the cost of residential care. So who pays for residential care? In a retirement community, that's private pay. An assisted living is private pay. Nursing home, long-term care Medicaid. So you have to have long-term care Medicaid or be pending for long-term care Medicaid, or it's private pay. And memory care is private pay. Medicaid pending takes roughly about 45 days or longer in the state of Texas. For Texas, you can't exceed Social Security more than $2,000 per month. If married, you can own no more than one house and one car. And all of Social Security would go to the facility except $100 per month that would go into a trust for the patient use. So like if they needed specific clothes or if there's specific things that they might need at the facility, then that $100 per month would be like a little fund for them, petty cash for them to use at the facility. So in some cases, long-term care insurance, some people have long-term care insurance, and long-term care insurance hopefully would be able to kick in and provide assistance for provider services or for living in facilities, personal care homes, or whatever the case may be, nursing home. But in order for long-term care to start paying, a policyholder must typically meet the benefit triggers and the elimination period. There are two sets of criteria required before benefits start. Benefit triggers are eligibility requirements an insurance company uses to determine whether a policyholder needs care and the type of benefits they'll receive. A nurse or social worker from the insurance company will usually conduct an assessment to determine the senior's level of need. Many times, policies require that the senior needs help with at least 2 of 6 activities of daily living or has a cognitive impairment. The elimination period is how long a policyholder must pay for their own services after the benefit trigger begins. So you must pay originally from the beginning during this elimination period out of pocket. It's similar to a deductible like for health insurance or car insurance, but instead of it being okay, if you pay $500, then we'll kick in and pay the rest outside of the $500. This is actually measured by time, not money. So many long-term care insurance policies allow policyholders to select the length of the elimination period at the time they purchase the policy. It can often last 30, 60, or 90 days, depending upon the option selected. The majority of the time, most people select the 90-day option. So that means for 3 months, you or I or whoever's responsible for paying for our loved one to live in a facility, them if they have the money, would pay 3 months of the 3 months of rent, 3 months of the fee for wherever they're living up front. And after the 90 days, then the policy would take over. So they wouldn't reimburse you for the 3 months that you already paid. But in the event that your loved one dies within that 90-day period, then majority of the time you get nothing. So hopefully with me sharing this with you in your life, your loved one, or if you have a current long-term care insurance, that you take a look at what the elimination period is, or if you are advising someone on getting long-term care insurance, that they, which probably costs more to get the 30-day elimination period rather than the 90-day, when looking at long-term care insurance and how they're going to pay for whatever additional services. And that's why it's also important to not wait until you have caregiver burnout to use these resources. You've paid, your loved one may have paid into it. You may have had it for quite some time. It's there. Don't wait till it's too late to try to get help from these services. So 2 out of 6 activities of daily living that's not a lot, or has a cognitive impairment. So think about it. If your loved one has dementia, more than likely they have a cognitive impairment that would qualify them to start using their long-term care insurance. So another tidbit for you to take from me today, look into this if this is something that you have, and start trying to use it ASAP. Use it or lose it. I only have 4 minutes left, so I'm going to try to hurry. So the cost of nursing home care, and these are the national median costs of nursing home care this year in 2023. A semi-private room, which would be a shared room, is roughly around $7,908 monthly, $94,000 a year. A private room would be median cost $9,000 monthly, $108,000 annually. There's been a significant increase in the cost of living since pre-COVID. So just to give some examples, right now in Texas, which if you don't live in Texas, you should probably move here because for a semi-private room for a nursing home, we're looking at about $5,000 a month, $7,000 for private. If you live in California, we're looking at $9,000, almost $10,000 for semi-private, $12,000 for private. And in Florida, $8,600 for semi-private and $9,600 for private. Again, these money amounts are not to scare you, but again, if you have long-term insurance, think about the benefit of that if your loved one needed nursing home care. So really, just for you to have an idea of how much this costs and how much would be paid out of pocket. One huge misconception that we always receive is that Medicare covers or pays for a nursing home. The only time Medicare pays for a nursing home is if you're receiving skilled rehab therapy. So Medicare will cover a specific amount of days for rehab therapy in order to get the patient back to their baseline before the hospitalization or before an illness that they may have. Medicare does not pay for someone to live in a nursing home. Medicare does not pay for anyone the cost of living for anyone. Just want to make sure I highlight that. If you're living or if you're looking for living in assisted living, a private care home, a residential care home, the median cost of assisted living is about $148 per day, which equates to about $4,500 per month or $54,000 per year. Again, in a nursing home, your loved one's receiving 24-hour care a day, clinical care. In an assisted living, it's about half the cost. But again, they're not receiving, they're somewhere to live and they're safe for 24 hours a day, but doesn't necessarily mean they're receiving 24-hour clinical care. There's also additional move-in fees. So there's community fees. So think of it like an HOA for an assisted living. That can range anywhere from $4,000 plus. So that's something you have to pay out of pocket when you move in. Care can be increased based on the care need. So in the event that your loved one is needing more assistance with activities of daily living or needing help with feeding, which is part of activities of daily living, they're needing more assistance with bathing, then the fees will start to increase based off of the care needed for your loved one. So you might start at about $4,500 per month, but based on the care plan of your loved one, you could see that easily go up to $6,000, $7,000, depending upon the care. So that's something that you'd want to discuss early on. There's one service that can help you, support you, and navigate additional care, and that's hospice. Hospice provides an interdisciplinary care team, which is a doctor, a registered nurse that helps with medication management, symptom management and teaching, a home health aide, assistance with activities of daily living, which the hospice home health aide would be able to offset maybe some of the private caregiving services that you're needing. So let's say the home health aide from hospice would be able to come 3 days a week to help with bathing, and you only needed a private provider care service to come another 3 days to help with bathing or whatever assists activities of daily living. A social worker, which provides caregiver support. A social worker can also help with providing respite, which respite is a part of hospice to help prevent caregiver burnout. And if there was something that was to arise with the caregiver, respite is in place for that. We also use respite as starting that transition to placement. So if we are looking for, you use it as an opportunity to try out a nursing home before actually moving in. So hospice would provide respite care at this specific nursing facility. And so your loved one gets used to going to that facility, and you get used to working with that facility, and you actually get one-on-one experience of the care being provided in that facility. So that's one of the highlights of working with hospice, and hospice helping to navigate and support you through placement needs. The social worker can also help with Medicaid or filling out Medicaid paperwork, what's needed. Also can help with navigating veteran affairs. So navigating, to ensure that your loved one is connected to the VA, that the spouse or the caregiver is receiving their, because they have excellent caregiver support as well. The VA also covers nursing homes or long-term care, and sometimes has private care homes. So if your loved one is a veteran, there are tons of support for veterans. So I definitely would navigate that, but hospice social worker would be able to help you navigate it so you don't feel alone in that process. Chaplain helps with spiritual needs, and then a volunteer would also be able to come if needed, when needed, to do whatever, read to your loved one, play games with your loved one at home. So hospice is not a place. Hospice is a service that goes to wherever your loved one calls home. So if hospice care can start at home and help navigate care as your loved one's disease starts to progress based off what's the best option for your loved one. So hospice can start at home, hospice can start in a nursing home, hospice can start in an assisted living. Wherever that is though, hospice can help you navigate these things so that you don't feel alone and you have support. And it's 100% covered by Medicare. So there's no cost for hospice. That's another great thing. There's no cost for you to have hospice services and for you to have this additional care for your loved one as well as for yourself as a caregiver. So this is my next to last slide. There are additional care navigation options. There's elder law attorneys, there's placement finders, there's caregiver specialists. Shout out Cindy. Sharing experiences. So we learn by sharing experiences or going to facilities, sharing those with others, because we want our loved ones to receive the best care, and word of mouth is the best way to share those experiences or share some good tips. The primary care doctor, which I know they don't have a lot of time to navigate and go through all of this with you, because as you can tell, it took me over an hour, but that might be also a good place to start. And then case managers or social workers in nursing homes. So if your loved one's on skilled, they can help you navigate. If your loved one's in the hospital, they can help you navigate what the next steps are as well. So these are just some additional care navigation options, and I will just stop talking and leave room for questions.
Candace, I want to say one thing first. We're about 5 minutes over the hour. And if you're willing to stay for another 5 or 10 minutes to pick up the chat, I'm certainly willing to do that. But I did want to say one thing. When you were talking about the cost of things and about Medicaid eligibility, every state is different. And it's really important you go and talk to your Medicaid field office, in your neighborhood. I just want to give you an example. In California, they just raised the amount of assets that you can have in the bank. I think it's to $120,000, because you can have just one house and one car and the list that you mentioned, but different states have done different things. The other thing is, if you're going to a nursing home, they have spousal impoverishment rules. And I know Texas has this rule that, they protect the person who stays home, and gives them enough money to live on. And that's the way they calculate how much they're going to pay the nursing home. So really work with your local folks and don't just, say, oh, nobody pays for that, I got to keep them at home and kill myself, doing 24/7 care. And that's my word for the day. Do you want to take the chats, or do you want me to read them to you?
If you want to read them to me, and thank you for touching on that, Evelyn. One of the biggest opportunities, when I call it a myth, is that, I don't want to talk to Medicaid, or I don't want to use Medicaid because I don't want them to take my home, or my home is my only asset that I was going to leave behind for my family, or my wife's not going to have somewhere to live. So in Texas, that comes up very often. In talking with my social worker here at VITAS, one of her main recommendation was talk to them. Like, they will have options. There's ways to navigate through it, and they'll give you options. So don't be afraid to talk to them and think that even just by talking to them or trying to understand what services are available to you, that they're trying to take away your home, or they're trying to not help you. These services are all here to provide help and support. And if you have challenges navigating, there are people out here that can help with that as well.
Perfect. And I want folks to know that we are going to send out some of the resources that we have talked about or are going to talk about with the post-session questionnaire. And that questionnaire will come in a couple of days, and we really hope you'll fill it out. And if you're not registered, please register at 866-390-6491 to make sure that you get those resources. Also, I wanted you to know that caregiverteleconnection.org is where you will find the podcasts, and we'll put that information into the resource list in addition. Now, let me see, one new message, two new, okay. My mom is now on Medicaid. I was told Medicaid would take a certain amount and leave $60. Is the $100 allowance new? Different in every state. I answered that one, sorry.
Yes, and that's why I said in Texas. So it could be different. There's different scenarios based off of how much. So if it's $2,000 and they leave $1,000, if your loved one was getting less than $2,000, then it may be more.
Right. Okay, one from Jane.
I mean, maybe less, sorry.
Yeah, sorry, I wasn't paying attention. One from James, I recommend visiting your local area agency on aging, and that will be one of the resources that we're sending out to you to speak with a state health insurance professional. We call it the SHIP program. And the area agency on aging not only has a program to talk to you about your different options, they also have elder law attorneys. They have elder care, legal services. They have caregiver specialists. So that's a good place to go. And thank you for that, James. They can help you determine what insurance program you could access. And a lot of times people have a hard time deciding between managed care and traditional Medicare, and they also can help with that. Let's see what else I have here. Thank you, Candace. Yes, for caregiver support, call our toll-free number. Okay, if anybody has any additional questions. Let's see, what else do I have? How can we find residential homes in our area?
So again, one option is using a placement, one of the placement locators. So they would more than likely ask questions around budget, and usually based off of your budget, which you always want to know your budget first, and know what that hard stopping place for your budget is. But based on your budget, they would recommend some facilities or residential care homes in your area. There's a Place for Mom, which is a website online, or you can always, depending upon where you are, if you're in Texas, you can call me and I can help make some recommendations just because I want to gear you in the right place. But or even wherever you are, I'd be happy to help you make some recommendations. But really looking online, doing tours.
You can also go into Medicare.gov. Medicare.gov rates nursing homes and residential care facilities. And you can put in your zip code and it'll show the ones that are closest to you. So that's also a good resource. I have one from B here. I am caring for two parents, one with dementia and a veteran, and the other with Parkinson's. They do not qualify for Medicaid. What is the best way to deal with mom's need for a caregiver in the near future?
Call Cindy.
Well, where do you live? I mean, there's a problem, but you can call the elder care locator and they can tell you where your area agency on aging is and the caregiver specialist there, and they all have them. The caregiver specialist there can help you figure that out. So you can get some help. Now from Irma, oh no, that was about the hour of the presentation. Oh, B is in Texas. All right, B is in Texas.
Hey, we're getting started, B.
All right. So
if you live in Texas, let me just interject. This is Javi with WellMed Caregiver. Look up community attendant services. The income's a little higher. It's a Medicaid program for people that do not have Medicaid. And I don't know the figures right now, but just look up community attendant services if you're in Texas.
Wow, thank you. I just want to say that this has been a fabulous presentation. I think we should probably end right now because we've taken up people's time. Yes. But I want you to know that we will give you some resources.
Just one quick one that came in halfway through the presentation.
Oh, thank you.
Michelle had asked, are medications in addition
All right.
on top of these cost estimates? I am assuming they mean are medications included, or is that something separate that they have to pay?
So usually the medications would be billed to the patient's insurance. So for most living in a facility, the patient would still be responsible for the medications unless they're in a nursing home. So if assisted living, like it depends on their living setting. But just saying like you would get delivery from the grocery store, from CVS, Walgreens, or whatever pharmacy your loved one might have, it really just depends. The only one that covers medications, and that's attributing to the diagnosis, is hospice.
Great. Candace, thank you so much. You've done a beautiful job once again. I know that last time you agreed to give people your slides, and I'm thinking with all those wonderful questions that maybe people would like to have the slides from this show, if you're willing to do that, because that would be wonderful. And then they won't have to think, what was I supposed to ask at this point? So I want to thank you. I want to thank everybody who participated today. You know, it was a fabulous presentation, and it will be on our podcast in a couple of days. Also, I want to let you know that we have many other presentations coming up this month. This is the beginning of the month, our first one, but we've got 7 more, and we've got on general caregiving, and we've got 4 on LGBTQA topics that are going to happen during the month. So get registered, and you'll get those monthly calendars. And thank you so much for being here today and for what you do. And I'd like to thank the WellMed Charitable Foundation. That's you too, Javi, because it's so wonderful to have these kinds of resources available. So everyone, I'm going to stop the recording now. Once again, thank you so much.